Thanks, Tim. Appreciate you the intro. Uh, Definitely getting better with that, Tim. So thank you. And I have to thank Tim and Jen, our information specialist. She's going to be in the background giving us the information. I also like to thank the foundation for my monthly podcast. It's without your support, this would never happen. I appreciate them thinking that psychology and mental health is a very important part of recovery from spinal injury. I also like to take the opportunity to thank Angela, who recently has left the foundation. I was nice to work with her, and she has given me a lot of guidance throughout the last few years when I've been working with the foundation. Today, we're going to have a couple of things. I'm going to introduce Mr. Billy Vickers in a second. I'm going to have my assistant Keely today. She's going to be helping me out. And she's my student and assistant of mine who's going to help me out with some of the questions that are already under registration. We're going to address those questions after we had a talk with Billy. So Keely, thank you for today. And so as you see, we have Billy on here already. And first of all, I have to say, he's on vacation. And he is on vacation, and he's willing to take a break from vacation and be on our podcast today. So Billy, thank you. Now, Billy is he has worked as a mentor with people with disabilities. Here's my little intro. With 3 different hospitals in Michigan. He runs multiple support and advocacy groups. He's also on the DNR Disability Advisory Council, again, for the state of Michigan. And he's also an advisory board for the Metro Parks for the state of Michigan. So welcome, Billy.
Thank you very much for the introduction, Dr. John. And I might have jumped the gun by coming on a little bit too soon, so I apologize about that.
That's okay. That's okay. It's, this whole process, a lot of times, is very nerve-wracking for everybody. But try to be yourself. I'm going to try to dig into your brain a little bit, and hopefully our listeners will also be intrigued and want to ask questions. So listeners, feel free to throw some questions out there for us today. The more you get interested, the more you're involved, the better this process is. Now, over the last 2 years I've been doing this, you've heard a lot about the things I've done and things, and I thought, you know what, this July and August, maybe it's better if I have other experts instead of just me. Trust me, I have plenty to talk about, and maybe even to gripe about as I'm going through some things with osteoporosis and bladder issues and all that good stuff. But for now, let's figure out what Billy does and how does he manage his life. So the beautiful part about what I love about this process is you get a lot of perspective as a quadriplegic from me. Now, Billy, I know you're a para, right? What level?
Correct. So T6, Asia
T6.
A. Yep.
So, I'm always jealous of the paras, anybody that has upper body, I get a little jealous of. So Billy, tell me a little bit about your injury. What, when and how did this happen to you?
So I was 22 years old, working full time, had a very active social life, had a crotch rocket, a motorcycle. I was living life, working construction, going to school. On my way home one night, less than a mile from home, a gentleman pulled out of a side street. I was on my motorcycle and went through his windshield at about 50 miles an hour. And I didn't have riding gear on. In fact, I had Doc Martens sandals on. Ended up going through his windshield, and the gentleman proceeded to drive probably 400 feet down the road with me stuck in his windshield. So, yeah.
Wow. That must have been a scary process. When did you know paralysis was gonna be forever? When did that hit you?
Well, and again, it wasn't. I think a lot of people go through this. We always kind of like to say for the first 2 years, it's a big learning curve. You got to go through the grieving process, the acceptance and everything. So even for up until the first 2 years, I was under the impression, nope, I'm going to get better. I'm going to do therapy as hard as I can. And I even went to Portugal. I was the 30th person in the world to have the olfactory nerve cell transplant from Dr. Not Dr. Shi, Dr. Carlos Lima out in Portugal. So I was very active in my recovery, and it took me quite a while. And don't get me wrong, I mean, even 20 years post-injury, I still have hope. I don't have hope I'm going to regain total function and be able to walk again, but the fact that you can stay as physically active and as active as you possibly can in your recovery, there's always hope for recovery, for regaining function, for regaining strength.
So you still have the desire to walk again or some form of ambulation?
I don't, again, probably not ambulation. If I can get bowel and bladder back, that would be end for.
Yes.
That would be anybody that's been injured for quite a while. You kind of like to talk to them like, oh, well, what would you rather get back? Walking, function, or it's usually you can always tell the people that have been injured the longest, because the first thing they'll say is bowel or bladder.
Yeah. Those are the holy grail, isn't it? The bowel and bladder.
Without question. Even here, we're on vacation, and the biggest thing is the morning routine. It just takes so long to get going, and it kind of dictates your day of, well, how'd the bowel program go? How's caffeine going? So, yeah.
Absolutely. So those who are listeners out there, I'm curious if you want to put in the chat there, how long did it take you to get over and figure it out you're not going to walk again? And similar to Billy and I took me a few years. I was like him. Oh yeah, there's nothing that's going to stop me. I'm going to get through this every day. And so it took me a few years to really figure it out. About at least 2 to 3 years. So, and similar to Billy there. And so let me know if you, how many years did it take you? Now, you just mentioned a little bit, Billy, that you actually went all the way to Portugal to do some experimental programs there?
I did. So they had an experimental surgery called olfactory nerve cell transplant, and they take the olfactory cells, which are up in your nasal cavity. Supposedly they regenerate at a very high rate, more than almost any other cells in your body. And they take those out, they harvest them, and they open you up wherever your lesion is and pack those cells in there, hoping for regeneration or recovery. So,
wow.
Yeah.
Now, how many years have you been injured?
19.
19.
Yep.
And can I ask you how old you are?
41.
So you're young.
Yeah.
No, I guess I could have added the math. You said 22 and 19. Yeah. I was 19 when I was injured. And so you're 41, you're still young, you're a para. Can you pop wheelies on that wheelchair of yours?
Yeah, I'm not the best at it, because I have other buddies that can ride wheelies all the way down ramps and stuff. And I'm one of the paras. Yeah,
you're getting me jealous. Bumping down steps. You go down steps with your wheelchairs?
We can. Yeah. I mean, we're very active. We do a lot of things that normal, you wouldn't find normal people with disabilities do, whether that's trout fishing out in the middle of nowhere, or tonight we're going to go kayaking down some rivers up here. So yeah, we're very active. And again, none of it's accessible, but you got to make do with what you have. So
right.
Yeah.
So you have a T6 complete or incomplete? Complete.
Yep.
And so what aspect of your injury, based on your level, was the hardest? So you have 19 years of this now, so it might have changed over time. So maybe you want to tell me what was the most hardest part in the beginning, and I would love to know what is the hardest part now that you've done it 19 years.
Well, we've actually kind of touched on it. So before my accident, I was a college athlete, played soccer. So obviously my feet were very important. You take for granted how much core it takes to do everything. And then you quickly find that out being a paraplegic that, oh, wow, a lot of people see you in the chair and they're like, oh, you're paralyzed from the legs down. Like, no, I don't have stomach muscles. I barely have chest muscles. I don't have my full diaphragm. So even we were kind of laughing yesterday, even coughing or clearing your throat becomes an issue. So throughout the years, to answer your question, that answer has probably changed quite a bit. At first, it was the walking, without question. It was, you focused on all the things you couldn't do and all the things you missed doing. And then it turned down to what you had left and how hard it was. And that turned into the bowel program, the cathing, the UTIs, the skin sores. For those of you who are listening, skin sores are, we always tell people, bowel, bladder, skin. If you could master those three things, the rest you'll be fine.
Yes.
But
Yes.
you know, the skin wounds that come along with it. So it was almost kind of like, the more I got acclimated with my disability, the more those things became the forefront of now the bowel program is. I think I might be a little bit different because I had colitis when I was first injured. So I went from almost 190 pounds to when I was discharged from Craig Hospital and flew home, I was down to 125. So I had lost a substantial amount of weight. So my introduction to spinal cord injury was 10 accidents a day. And I thought that was normal because I don't have use of that anymore. So now that I'm home and got acclimated and got on a bowel regimen, my bowel program is an everyday thing. Sometimes it takes 45 minutes, sometimes it takes an hour and a half, and I don't change it for anything or anybody. It's 20 years later and it's every morning, and I'm doing, do my due diligence in there. But again, it takes up a major part of your life. So
Yeah, we almost become obsessive compulsive with our bowels, don't we?
without question, yeah.
And I can only imagine. Do you watch what you eat all the time then?
Yes, probably not as much as I should, but I know that, like, up here we're gonna have a burger and fries. I'll pay for it. So if I watch what I eat, I'm a much happier person. Yeah, because then the bowel programs are easier. So
Can I say that in the beginning when you're having all those 10 bowel accidents a day that your life was quite shitty?
without question, without question, no pun intended. Yeah.
Now, I love what Rolando says walking is overrated. And that's correct. Walking, once you get to a certain years of being disabled, you're not thinking about the walking. And would you agree with me that sometimes when you see all these individuals who, I don't know, maybe it's just me, but when they say, oh, I'm going to walk across the stage on my graduation, or I'm going to use the functional electrical stim, and you look at it, to me, it's not functional walking. I mean, you can't get across the street without getting hit by a car, because it would take you 50 minutes to get across the street. What are your thoughts on that?
100%. So I was one of those people that being from the state of Michigan, we had auto no fault. And me being injured in a motor vehicle accident, I had auto no fault. So
what does that mean?
So auto no fault, basically, if you get injured in the state of Michigan in an automobile accident, you had unlimited, and I'm about to make a lot of people upset. You get unlimited care, you get unlimited hospital, you get unlimited PT, you get unlimited, like true unlimited meant true unlimited.
Wow.
The problem with that is exactly what it sounded like. Too many people took advantage of that system. And now we have had a reform, and now unlimited is not unlimited anymore. So it was kind of like, well, how many catheters do you need? Well, we'll send you out hundreds and hundreds of more than you need. And, people got caught with fraudulent billing and fraudulent PT and you name it. So we had major reform here in the state of Michigan. So, but to get back to I did that. I did the unlimited PT to where I was in physical therapy 3 hours a day, 5 days a week.
Wow.
I walked 1.5 miles in CAFOs. And exactly like what you said, it took me probably 6 months to get to that point, but I'm not going to put these things on as a paraplegic complete Asia A and go walk through the grocery store. It'd take me 45 minutes to get inside the store. So it was almost kind of a, do I want to get back to work? Do I want to get back to my social life, or do I want to spend my life in rehab? So I got back to living, not that the people that are stuck in rehab and, like you said, hooked up to the electrical stem, they're not living, but you have to weigh the pros and cons of everything you're doing. And for me, exactly, it just wasn't functional. And I'm a big proponent of eStem. Like, I have an electrical stimulation bike that I ride 3 times a week for muscle tone and activation for bone density. It's called an RTI bike. So,
and that's the challenge. I mean, and maybe I probably leaned a little bit way too far on one side than the other. I spent most of my time working and trying to be productive and functional. And I probably didn't spend enough time being with my rehab. And so you have a little balance going on because it sounds like you're working, but yet you're still doing the e-stim to keep, because I just been diagnosed with osteoporosis. Well, I probably been diagnosed for a long time, but I should have been treating it. But you are doing a little more balance than I am. You're doing the work and some e-stim.
Yeah, that's for me, that is the key, is you have to balance it, because if you spend all day, every day in the gym, you know, a lot of people with disabilities, they don't work, they don't have jobs. You got to be able to provide for yourself. And I kind of always go back to when I'm peer mentoring people. A lot of people forget, people with disabilities, we have issues and we have problems, but so do able-bodied people. Able-bodied people still have bills to pay. They still have issues. They still have, you know, kids to feed and deadlines, just like we do. Sometimes ours are a little bit more amplified because we have a lot of other things that come with it. But yeah, I mean, everybody has problems. So
Yeah, you're absolutely right. You know, we do have problems. Everyone has problems, and Susan rides an RTI bike. Leah rides a Mayo cycle bike. So sounds like there are a lot of people riding bikes out there. So they're getting maybe a little more balance than what I've been doing. So coming back to you, and this is we were talking about this a little bit. You know, you and I have spoke at medical schools already, and you know, they always talk about relationships and sex. So I'm already going to throw it right at you in this beginning of our talk. Already, I'm going to get deep here.
bring it to me.
All right.
Come on, let's get real.
Tell me, how does your level injury, now you're a para, you got good hands, so how does that affect your sexuality and intimacy and your relationship? So it's pretty broad. So tell me, we'll start with the softer one. How does it impact your relationship? What's it like dating? Are you married right now? What's going on?
No, so I've never been married. I've pretty consistently been in long-term relationships. I'm currently in a relationship with the love of my life. She is absolutely incredible. And again, that was a fear of being disabled. Well, now how is somebody going to find me attractive? You find that people, oh, I don't see the chair, and we don't buy it. Of course you see the chair. I'm sitting in it, like there's a lot of stuff that comes with this. You better see the chair. So to find people that kind of just pick up that and just, they have no problem, either it's pumping your gas or loading your chair, helping you out with stuff that you might need help with. It wasn't like it was before. Like I said, I lived a very active life before my accident, very active social life, to where I was out at the bar 5-6 nights a week, hooking up with random people. And that all for me went completely out the window, thank God. And now my relationships, including my relationships with friends, I don't have Facebook, I don't have Twitter, I don't have Instagram, I don't have any of that stuff, because my relationships with people one-on-one and the people that I held value in my life, I find a lot more, it gives a lot more back to me if they're of importance. If I get something
more
back.
Rewarding that way.
Correct, exactly. So for me, that I find a relationship with somebody, it's not a fly-by-night type thing. They got to be in it for the long term. So
you're saying I'm in a chair, and they're saying I don't see it, and you're like, that's BS. I know you see it. You're just not asking about it yet, right?
Yep. Yeah.
And for a second, when you said you weren't married, I was going to tell all my listeners, look, Billy's available. But you added that you're already in a long-term relationship. So
she's probably on the call watching, and yes.
I better behave then.
You're fine. I'm sure she's laughing her head off right now. So
okay. So before I go on, Tim asked, what kind of results do you get with your FES? And you're writing it several times a week.
Yeah.
Do you get good results? How does it make you feel on that?
So while I'm on it, it makes me feel horrible. I mean, you're basically strapped to an electric chair for your legs, abdomen, and glutes. It's not a fun ride, but I've done it for probably 17 years, and I actually have bone density in the 98th percentile of even able-bodied people for my age group. So, and I attributed that to the FES bike. So while I'm not up walking like I used to, and I'm not doing the therapy like I used to, where I'm walking a mile and a half in CAFOs, that for bone density, for muscle integrity, for to strengthen your ligaments, I mean, it's so beneficial. It's not even funny. And I hear horror stories of people botching transfers and falling out of their chair and breaking femurs. And that to me is just, it's avoidable, first of all, but it is, the thought of it is terrifying.
Right.
So if you keep up your bone density with an FES bike, if you have the chance of that, or staying active, you know, it just limits the possibility of kind of what we went back to before. If you can do the skin, bowel, and bladder, and skin also for me incorporates bone density and everything else, kind of the muscle in there. So yeah, if you can minimize secondary issues, that's key for an injury. So
Right. So coming back to our initial question, and because I jumped off on topic for a second. So you're dating, you're in a long-term relationship. What is can I ask what your significant other's first name is?
Christine.
Christine.
Yep.
So when does the talk come about sexuality? I mean, do you remember that talk? Do you remember, or was it just so natural because of her personality? Was it hard for you to talk about it, or was it?
No, for me, it wasn't. I know for a lot of other people that might be, but you know, it's kind of funny, especially having a psychologist on the call. When you talk to people, whether it's in relationship problems, they're always going to tell you, well, communication is the key. And that couldn't be more true when you have a disability. You have to be open about things that we've been talking about on this call, with bowel programs, with cathing, with infections, with I'm sure, you know, what stuff that you might deal with autonomic dysreflexia, and how that correlates to sexual function, how that could be detrimental. So while you're having fun, you also don't want to be having AD, because those two don't go together very well.
No, they don't. They don't.
Yeah.
I mean, the orgasm, the ejaculations comes with the AD.
Yes.
And
so, yeah, if your partner doesn't know about that, you're in for not a good time. So
yeah, so you're thinking, oh, she's thinking she's doing great, and you're like, oh my God, she's gonna kill me right now.
Take me to heaven really means, take me to heaven. Like, yeah.
I'm glad you're able to communicate with her. So, have you ever been in relationships where they just could not accept it? It was just, or did you choose and pick certain people that are like, well, you knew they were going to be able to accommodate that?
For intimate relationships, no, because it never got to that point. I kind of got all of that out of my system before my accident happened. So I only allowed people in my life, especially for dating, that I knew were going to kind of be sticking around. The one night stand and the dating, that, you know, the finding the people on Plenty of Fish and stuff like that, I fortunately never had to worry about that, because after my accident, I was always kind of looking for relationships. So even though I was young, I had lived a pretty fulfilling life, I guess you can say, before my accident with the Barsing. So I kind of got that out of my system at that time. So
I'm going to shift gear a little bit about just, I'm going to go into the psychological part, because, and again, it might be changing as you've gotten older. How do you cope with your limitations and your disability? You know, what made it work in the beginning of your accident, and what's making it work now? And here's the critical one. What do you, is there any regrets? Could you did it differently?
Oh yeah. I mean, the regrets are kind of the things you can't fix, which I believe is kind of the key thing for being a peer mentor, that if you can allow other people to learn from your mistakes and have them do the shortcuts you didn't take, you know, that's what peer support and advocacy is all about. So, and I was hard-headed. I still am. I'm a hard-headed person, and sometimes I have to bang my head against the wall a couple of times before I learn. So, the most frustrating thing for me was just after the 2-year mark, that this is my life, and what am I going to do? How am I going to provide for myself?
How'd you get around that then?
Support from my family. For the people on this call that do not have that support, it's almost kind of like, I feel lucky, I feel blessed. I don't know how they do it, and how that to me is kind of for me, it was that I didn't really have an option, because I had so much support around me. So when it came to insurance benefits and health insurance, and I had other people doing that kind of stuff for me. All I had to focus on was my recovery. All I had to focus on was getting out of bed every day and just kind of, well, do you want to go to therapy? What do you want to do? But I talk to other people that are not in that situation, and I almost kind of want to pick their brain of, man, you guys are amazing. How people get out of bed every single day and still persevere and still push forward. So for me, I had all the support in the world from my friends and family.
So it sounds like you were blessed with, not with the accident, but you were blessed with the family support, the a lot of things in place that you were focused on just your recovery, and
100%.
the other people around you got the paperwork and logistics and insurance and all that junk that you have to deal with when you are newly injured.
Yeah, 100%. 100%.
And
So
at this point, at 41, what have you learned that says, look, this works, but this other stuff I keep doing? You say you bang your head a couple of times because you keep doing the same thing. As a psychologist, that tells me you're a little stubborn on some things.
I am, but
So
I think
Christine, tell me, you better write in the chat what is he so stubborn about? So what is not working for you and what works for you at this point in your life?
I think it can go both ways. So being stubborn, obviously, if you do it enough, then that could be detrimental. But if I think we can call that persistent, which might not be a bad thing. So it's kind of like recovery. A lot of people would go to do therapy for a week and they're like, well, that's not doing anything for me. I did therapy 5 days a week, 3 hours a day, and I did that for 12 years of my life. And I still do CrossFit. I still go to the gym as much as I possibly can. Just kind of getting back to what we broached on earlier, it's a balance, because I almost overcompensate because I can't use or move my lower half. So I have to keep my upper half in top-notch shape. If my shoulders give out, I'm screwed with transfers, with everything else. I mean, I've had 2 shoulder injuries to where, doctors are saying, well, you're going to have surgery on it. And I'm like, well, what am I going to push in circles? So if you don't keep your upper body in half, or quadriplegic, if you don't keep what you have in top-notch shape, whether, Dr. John, that's your brain,
I don't know, Kelly just gave me that look where she's like, I know you don't do enough physically to keep your brain going.
I didn't mean to get you in trouble.
You just did, because she knows, and everyone knows, I am so focused. And this is the part that maybe you got to yell at me. I'm so focused on working and being productive and trying to impact the world with what I have with my brain, that I keep forgetting about my body. But I know my body's giving up already. I mean, I'm older than you. I'm a lot older than you, but my friends that I know that pushes manual chairs, I know their shoulders give away in their 50s, Billy. I mean, I don't know if you're thinking about that already down the road with the overuse syndrome.
So it's a double-edged sword, though. If you don't use it and then all of a sudden you jump back into it, you're going to be like, I drive a lifted truck. And so if you can picture a younger guy with tattoos that pulling a handicap in a lifted big diesel truck, and I just get those looks of, what are you doing parking there? And all of a sudden the door pops open and I start unloading the chair, and it's always the same. Oh, do you need help? Like, their attitude changes. But all the therapists and stuff look at me saying, you're going to blow your shoulders out. But 20 years post-injury, I think my shoulders are in as good a shape as they possibly could be, because I use them and exercise them, and I constantly am on top of it. So if you lay in bed and you don't use your shoulders, I think you're more apt to have an injury. So
Gotcha. So again, you're aware of it, but you're trying to stay on top of it so that you are trying to be sensitive to the fact that you don't want to blow out your shoulder. And
right.
I also assume you're probably trying to keep your weight down and those things, not to gain too much weight.
Yeah, it just makes everything easier, pushing, transferring, everything. So
I mean, you seem like you have it, and a lot of us in the podcast world, maybe we try to pretend that we have it all together. Do you ever get down?
Oh, yeah.
You
All
ever-
the time. But again, it goes back to what we talked about earlier. Absolutely. I get down all the time, and it's important to embrace those times, but you don't stay there. Um, Everybody's going to go through dark days, whether you have a disability or not. I think sometimes it's easier to go down those rabbit holes. It's easier to stay in those dark times with a disability because there is so much adversity. There is so much stuff that comes with this. And I totally, I get it. I embrace it. But at the same time, it's important not to stay there. The easiest way to get out of that sometimes is just one step, no pun intended, just to force yourself to go out for a little push, force yourself to get out of the house, force yourself to be active, to do something, to read a book, to get out of whatever you're doing. That's just that spiral of never ending depression.
So I mean, I'm hearing a lot of things you're doing to cope with when you're down in that. First of all, I don't know why. You mentioned about rabbit holes. What's wrong with rabbits? Why do we not want to be in a rabbit hole?
I'm not even sure where that came from or what it means. Like, there's a rabbit hole never ending. I've never.
I don't know.
Maybe
People say it all the time. I'm like, what's wrong with rabbits? They look so cute, but why?
it might be
why
the
don't we
Alice
wanna
in
be there?
Wonderland reference to where you follow the rabbit down the hole, and I don't know.
I don't know, but to get out of that trap, you're saying you're doing a lot of active things, to get out, to read a book. Do you ever reach out to somebody? Do you feel like, it sounds like you have a lot of support around you. So, what would you say to listeners out there that says, what's the difference between being down versus being clinically depressed? I mean, I know from my perspective how to read that, but how would you read that on your side? Do you have an opinion on that?
Yeah, for me, if you're starting to have more gray days than not, if you don't have anything in your life that you're looking forward to or that motivates you, or obviously the triggers that with suicide and everything. I mean, if you're even contemplating that or thinking about that, you need to reach out and talk to somebody, and don't be too proud. I'm not one of those guys that's like, I don't need to talk to somebody. I've talked to so many psychologists and therapists throughout the years, and it actually helps to actually talk to somebody you don't know and just get it all on the table. And sometimes you'll actually solve your own problems just by talking about it. And you're like, okay, this isn't, in retrospect, this isn't as bad as I'm making it out to be. But if you keep everything inside bottled up, it has nowhere to go. It does just that. It just bottles up. So, but for me, if you're one of those people that every day you have nothing to look forward to, nowhere to go, and you don't feel like you have anybody to talk to, I think it's important that you have lots of people to talk to, whether it's a peer support advocate, whether it's a psychologist, priest, whether it's somebody at your church, anybody, it doesn't matter. Just reach out. You got to take the first step. You got to reach out.
Right. So reaching out, seeing a psychologist, reaching out maybe a professional when all the things around you may not be working at the time, right?
Yeah.
Sounds like. Keels, you have someone question here?
So I'll ask this to Billy. Leah said that she lives with her parents who are her caretakers, but her biggest issue is she often gets depressed because she can't get out like she used to. She doesn't drive and she has a hard time getting transportation to non-medical places. Do you have any suggestions for her?
Well, a couple things. I don't know how old she is, or why she doesn't have a driver's license, but our first step, especially after an injury, is we always try to tell people, if they're old enough, to go through driver's training, force yourself to that. Driving is such a liberating feeling, again, with a disability. Even if you have nowhere to go get in a car by yourself and spend 20 minutes driving around, whether you transfer, you leave your wheelchair behind, whether it's just a very liberating feeling. So if you have the opportunity, I would enroll in a driver's training course. Getting a handicap vehicle, it's probably not as hard as you would think. We have a lot of things here in Michigan, places set up that could help you with that. But driving for me is a huge one. The other one, if you can't drive, just get out of the house, go for a push, go to a park. It's important to just kind of get out of that. Sometimes I feel like the home could be a detrimental place as well as a very familiar and supportive place. So it's all depending on how you're kind of looking at it. if you're home all day, every day with your parents, and I was there for the first 2 years, and my parents were by my side the entire time, it's important. Again, everything's a balancing act. You have to leave. You have to have your alone time. You have to kind of see other people. So my first suggestion would be look into driver's training. The second one, make sure you're getting your own alone time in there. And maybe a change of face if your parents are your main caregivers, you know?
Yeah, yeah. I support you 100%, because when I was able to drive, and first of all, driving as a quadriplegic was like amazing. I was like, wow, all these, technology and to get out, you're absolutely right. I would just go out and drive just to go somewhere.
Yeah.
Even though I had no one to meet or stuff, the fact that I was running around was fabulous. And when I lost my driving privileges after many years, it's like, oh man, this is like one of the worst days of my life, because now you have to constantly find someone to give you that ride, and that was frustrating. You also mentioned that you need your alone time, and I'm going to want to reiterate that again. In the beginning of my disability, medically I was pretty stable, so I knew what I was going to have every day. So I didn't have a lot of caregivers around most of the day, and people would ask, well, why don't you have someone around? I was like, well, because I don't want to have someone around all the time. I enjoy my alone time, and I just didn't feel like I had to entertain someone half the time. That way I can study or do whatever I needed to do. So again, I want to reiterate a couple of things you mentioned. Driving for independence, and maybe you got to get out of the house so you can get away from your parents. Being 22, that's the last thing you want is your parents looking at you all day, right?
Yeah, I mean, you go from being an independent teenager or a young 20-year-old person to where you're focusing on going to school, going to college, and then all of a sudden you may have an injury or a disability occur, and somebody's over your shoulder 24/7. Somebody's helping you change catheters. They're helping you with bowel programs. Not only are you now disabled, but your independence, your identity, everything has changed. And I know we keep going to the balancing act, but I think it's important that these people that want to be around you 24/7, if you need help, you need help, but you also need your independence. You need to have your alone time in there as well, so that you keep your sanity. So,
Billy, shifting gears on it, how did the rehab prepare you? Now, I've been in Colorado. I know that facility. It's Craig Hospital is an incredible place.
yeah.
Do you think they prep you, or was there anything lacking at the time?
No, and again, I've seen a lot of the inpatient facilities here in Michigan and around the country, and they're all similar. They're all very similar. From my perspective, where Craig kind of was a little bit different was the education department. They literally took you in every single day in almost a classroom setting and taught you about disability and everything that we've been talking about: bowel, bladder, airplane transfer. To where when they said you're going to be discharged and you're going home, they said the doctors and therapists and surgeons you're going to be talking to about spinal cord injury, you're probably going to know more about your injury than they will. And, I kind of laughed it off. I'm like, I'm not going to know more than surgeons, but you go to ER with a person with a disability now, and the first thing they're going to want to do is throw you in a bed and keep you in there for 2 or 3 hours. And you're like, I got to worry about skin wounds. And they're like, skin wounds, skin sore. What's that? Like, it's important to be your own advocate, your own voice, because if you don't think about stuff like that, they're not going to. So
true, Billy, so true. It just happened to me a few weeks ago where I was at the ER, and then the first thing I said to him, I'm not going into bed. I'm going to stay in my chair.
Yeah.
And they're like, why? I'm like, because you guys are going to let me lay there for 5 hours, and I'm going to have to worry about a skin breakdown. So
exactly.
if it's okay with you, I'm going to stay in my electrical chair. You can put all your IVs and all the things you want, but I'm going to stay in my chair, and that way I can tilt back as I need it. And they're like, okay, we're cool with that. So yeah, being an advocate is huge. And I'll briefly talk about this, but I'll probably talk more in depth in another podcast. But recently we did a DEXA scan and found out, I have osteoporosis, and my endocrinologist, I sent her a file. I say, here's what is the recommendation for osteoporotic treatment for SCI that was just published last year by the Paralyzed Veterans Administration. And And she's like, thank you. I appreciate you sending this because you're the only spinal cord I have. So I had no idea what to do for you. So you're right. We are probably a little bit more educated and we have to advocate for ourselves. Last major question, and again, people in the chat room, if you have any questions for Billy, before I go on to the pre-registration questions, is there anything else you learned over these 19 years that you would have done differently and say, look, if I would have done this a little bit differently, maybe I'd be in a different position there. Is there anything you would, learn from your wisdom of the years?
For me, it's realizing it's a marathon, not a sprint. If you lived a fast life before, take a stop, take a look around and start to learn how to enjoy things. Everything is a little bit slower with a disability. Your prep time, you're getting out the door, just take your time, learn how to enjoy life. Before my accident, I thought I had everything mapped out from college to work to everything. And now it gave me the opportunity to kind of reevaluate the direction and the point of aim of my entire life. And when I tell people this, I don't think sometimes they believe me, able-bodied people, that I have probably lived a more full life with a disability than I would have had the opportunity to live in the direction I was headed with my able-bodied self. I've been skydiving, scuba diving, everything, but that didn't come with its hardships. There were, like we talked about, the first 2 years, they're rough. They're really rough. You focus on the what can't you do, instead of the possibilities of your disability. So for me, it's realizing this is a different life. It's going to be a different life than it was before. You can still be that same person, but going forward, things are going to look differently, and that's okay. That's okay to embrace. And it's okay to basically not have other people set your limitations for you, whether that be doctors, therapists, family members. Make this what you want it to turn into. Make your life be what you want it to be. So
you're saying, what we do in psychology a lot is it says try to look at your world a little differently. Try to look at the positive. Try to look at the things that you can do instead of you can't do. And I know these are all cliche statements, but that's what you have to do in order to make it in this world with a spinal cord injury, right? Because we are different from the able body, and we are when you go out your door, you're automatically told you're different.
Right.
So either embrace it or you're gonna lose, because the world's gonna beat you down. Right. So let's get to the registration questions. Keels, what do we have down here from the pre-registration?
So I think a great question for you, Dr. John, would be from Robert from Florida. As I get older, I have less strength and need a caregiver. He's struggling with the future outlook of his life. What would you recommend?
Well, I'm going to give my take, and I'm going to let Billy jump in. Well, you know what, Bill, you go ahead first. Can you go ahead, Keels? Would you read that again for Billy?
As Robert gets older, he's struggling with less strength and he needs a caregiver. He's struggling with the future outlook of his life. What would you recommend he do?
I would focus on what you're still able to do. Sometimes I think people get complacent. I know a lot of people, Dr. John, quadriplegics in particular, they're so used to having people care for them and do everything. They don't realize a lot of the stuff they could do on their own. I'm not saying it wouldn't be difficult, but you almost get complacent in your care. So while you might need help with certain things, also be diligent on focusing on what you still can do and hang on to that and still do as much as you possibly can, obviously in a safe manner. I'm not telling you to re-roof your house, but, hang on to what you still can do and make the most of it,
That's I'm not going to even add on to that, Billy. That's pretty much what I would have said. You have another question, Keels?
Christine did comment, and she said, you asked me about Billy's stubbornness. Part of the reason Billy is such an amazing human being is that he keeps going even when things are difficult. He doesn't give up, and he doesn't give up on the people around him or the people that he mentors. His personal challenges become gifts of wisdom to people seeking information, support, and direction.
Man. Now, when did you write that paragraph for her to send in? Because it sounds like you set her up to write that there.
This was all pre-planned.
Yeah, I know. But it sounds like a great lady there. So, do we have another question, Hughes?
Paige from PA, she asks, when do you decide living apart from your family is a good for all parties? She says her husband and son have been her primary caregivers for the past 4 years, but she's struggling with bowel and bladder issues that she did not have in the past. And they're becoming more of a problem because she's lost her strength.
Do you want to tackle this first, or you want to?
I'll let you go on this one.
Well, bowel and bladder's always been, as you said, it's it's the holy grail of life for all of us. I mean, I haven't remember a day where I can't, if I'm thinking, okay, if I'm going out to eat or I'm going on vacation, is it accessible? How's the bathroom? You know, who do I have to take with me? It is the crux. Now, for me, and this is not for everybody, I started using a colostomy because I got tired of the 3 hours on the toilet and all that blood everywhere every morning with the hemorrhoids. But UTI, that's a whole different ball game. Now you got medication issues and resistance, and I am guilty of, doctors in the past used to just throw Cipro at you. It's like, here, take Cipro. Now you're resistant to Cipro. Okay, so that's one of the strongest general. So for me, at this point in my life, well, I'm going to go back to Paige. For you, you still need to get out. It doesn't matter. Yes, there are going to be issues. You're going to have to figure out some tough things, but mentally and psychologically and developmentally, you need to get out because your parents aren't going to be around the rest of your life. There's so many people who are in that situation now that their parents are getting older and they no longer can be and won't be your caregivers. And what are you going to do? So you got to get used to taking care of yourself with the caregivers that are not related. So take over, Billy. What would you suggest?
100%. I sometimes think it's harder for younger people to break out of that nest because if your parents were parents and they're around 24/7 and they're caring for you, it's much harder to break off of that because not only are you leaving the nest, you're leaving your parents, you're leaving your main support and caregiver unit. So if I understand the question correctly, she also has a husband and son.
Did she have a husband, son? I don't.
Yes.
Oh, she did. Yes.
She did. So to transfer over the care for your husband or for your son, I don't know how comfortable you are for that. Maybe calling a care agency if you're not comfortable with your husband doing it or your son. I totally understand that. Having your loved ones do your bowel program. A lot of people, sometimes they squeam at that, which I understand. That's a totally different conversation we could have, but yeah, I mean, maybe you need to call in a care agency and just break out of the nest a little bit. So again, that first step is always the hardest.
Yeah, and I don't think we have a perfect answer to that, but I think the critical part, and Billy, maybe you would agree with this, is that you give it a shot. Yep. And you see what works. And what works for you, Billy, and what works for me, and what works for Paige may be completely different. Yep. But it's the opportunity to because you and I both agree that getting out is important and having some of that sense of independence. Now, I'm biased. Being a professor, I'm really biased about education because I feel that education is the opportunity to get a career that makes sense. Now, don't go to college. I've had people with disabilities that come to college and says, look, I want to be a geologist and I want to go look out rocks. And I'm like, how the hell are you going to get out there with your wheelchair? That doesn't make sense to me. You're picking the wrong field. And they're like, yeah, but I want to do it. And at that point, I have to step back and say, okay, I'm going to let this person learn. And they're going to have to fall on their own face if they can't get a job. But they maybe be a researcher and maybe they won't be in the field and maybe they'll be in the lab. So right. I don't know, but the point is get an education, try to find a field. I always push computer science because I think being people who are in computer science, because that's the future. I don't know if you should anybody will be a psychologist. I'm not quite sure if I want you to be a psychologist, but be an educator, what are your thoughts on education, Billy?
I love it, but again, now more than ever, make sure you have a point of aim. Dr. John, you touched on that. A lot of people right out of high school, they go, oh, you got to go to school. Well, what are you going there? I don't know. Just going to school. Well, have a point of aim. I mean, trade schools are great. And even with people with disabilities, you can still go to a trade school, even with a disability. There's no harm in going to, just make sure you do something, whether that's continuing your education or going to a trade or doing something. You just, you gotta be diligent, and I'd be having this conversation with able-bodied people as well. So
True.
yeah.
So true.
Yep.
Hughes, what's next?
Lynn from Connecticut would like to know how to deal with chronic issues such as shoulders, and as well as what do you think is the best way to maintain a bowel regimen in the hospital, as well as keeping yourself free from bed sores without moving?
So a bowel regimen in the hospital and keeping yourself from bed sores while you're in the hospital. You know, I've heard of so many people first thing I do when I find out I have to be hospitalized, is like, you got to get me a bed that makes sense to me. Don't put me in, don't turn me I mean, if you have to turn me, yes, but if you get me one of those beds. So, you know, what are your thoughts on this question there?
For me, going into the hospital, I know we touched on ER. The hospital for people with disabilities is a bed sore haven. If you're going to get a bed sore, that's usually where they occur, is hospitals. I know that sounds counterproductive, though. I'm going to a medical establishment. Why would I get that's where they happen. It's an unfamiliar surface. It's an unfamiliar mattress. And you lay in bed all day in the hospital. You're not up, you're not moving around. You're going to be in the same position. In those hospital beds where the back come up, that is the worst position you could possibly be in as a person with a disability, because it's literally putting all that weight into your coccyx and your sit bones, which that's not where we want it. So I touched on earlier, I had a wound and it got to a stage 3-4. That's where I got it, was a hospital. I was in there for a surgery. So to prevent that, make sure, don't feel like you're going to be bothering the nurses. Make sure those nurses are in there every half an hour, helping you turn, helping you move. That's their job. That's what they're paid to do. If you go in for a hospital, you know, for whatever reason, you leave with a bed sore, that's not a good deal. That's nobody wants that. Bed sores, they stick around for a long time. So.
Great. You know, one of the things that, well, first of all, we're about at 2:53. So I'm going to thank Billy for coming on and giving us your insight. You have a vast array of knowledge that is, you know, I can tell why you're a peer mentor, because
I appreciate it.
You give a lot of positivity. You give a lot of great answers. You have a supportive, you know, people around you, and they're able to cut and paste what you wrote for her to say. That's kidding. It sounds like she really appreciate you.
Yeah, you're very welcome.
One of the things, you know, I'm gonna sort of summarize what our talk today a little bit, you know, is when you are facing some hurdle, if the wall or with the thing, you know, the life does not stop. When you jump over one hurdle, right away, you know, there's going to be another one in front of you somewhere soon. And, you know, for example, with my osteoporosis, the first thing I did was I went on, and again, you're going to sound like I'm advocating for Christopher Reeve Foundation. Well, because I knew there's information there. I went there and I read about osteoporosis. Okay. So I read what I could that was on the website already on. So first thing I wanted to do is get as much information about the situation. Now that's how I cope. I need information, you know, as a person who's a psychologist, who's a professor. So I read about that. Then I reached out to people I knew. There's a great doctor named Dr. Greg Nemunitis out in Cleveland, great physician. Where I text him, I said, hey, Greg, what do you know? Where do I need to get more information? And he's the one that sent me the link about, hey, something we just written about recommendations on how to treat osteoporosis with SCF. So again, support system, information, reaching out, and Billy would be a person reaching out to peers, you know, because I know a bunch of my friends are going through these issues. What are you doing? My biggest fear when it comes to bones and things is kidney stones. Kidney stones they just causes havoc in my life. So I was concerned about that. I want to make sure I wasn't going to take any medication that was going to increase the production of those things. But having you today, talking about really integral things was great. People out there, listeners, please let others know about our talks. Let others know about our conversations. And Billy, if someone wanted to reach out to you, is there a place where they can touch base with you? I apologize, I didn't grab that ahead of time.
No.
Is there an email or something or anything they can you let us know?
Yeah, so a couple different ways. I work for another company that runs a Perspectives program. It's kind of a peer support program for people with disabilities, and that's for rehabandmobilitysystems.com. If you kind of go on their website and look up the Perspectives program, you can find my information there, reach out. The emails will go right to me. Also, my personal email, B as in boy, Michael, MICHAEL, Vick, VICK @gmail.com. It's another good way. You could text me. I'm a very open person. You don't mind if I give them my telephone number?
If you're willing to give it out, go.
Absolutely. Yeah. Again, it's in Michigan. So if the area code sounds funky, 248-240-4480 is my personal number. Feel free to text me. Dr. John, I'm sure you know that as a peer advocate, you guys can text any time of the day, night, doesn't matter. We're always on call. So, yeah.
Thank you, Billy.
Absolutely.
Kios, did we cover everybody? Is there any last minute things that we need to address?
Billy, do you have any recommendations for those who are struggling with mental health and their injury?
Yeah, don't wait to reach out to somebody. And again, whether that's a clinical specialist or whether that's just a pure advocate, don't wait till it's too late, I guess would be my advice to that person. So talking to somebody, it's very surprising how much better that makes you feel, of just getting stuff off your chest and sharing your experiences. And you'd probably be surprised of how many people go through the similar struggles as well as what you're going through. So, yeah.
Thank you, Billy. And Billy, again, this is the first time you and I even met. We've emailed back and forth a little bit about touching base and having you come on. I hope you would come on again down the road if there is another topic that that may be relevant and you were interested. I hope you can come back on. And
I would love that. Yeah, I would love it. So
because I think you did great today. We did great. Just like last month we had Derek. Derek was awesome and gave us a lot of insight about his life and what he was doing. And there's a lot of resources out there, listeners, and the goal is to figure out who to go to and what. And that, I think that's the critical part. Going to the right people that make sense to you. Liking the person. You gotta like your peer mentor. Just like anything, you gotta like your psychologist. So, Billy, if I'm ever in Michigan, man, is it okay I come out and hang out with you?
Look me up anytime. I'll show you Michigan the way it's supposed to be. Yep.
All right, I appreciate that. Listeners, thank you. Every month, we'll see you in September. School starts for me, so the world goes crazy again for my, I've been blessed with having a life that every year, pretty much most of my life, I have a first day of school. I feel like I'm like 5 years old, starting school again. So I get to start this fall, and I will see everybody in September. We're not sure what the next topic is, but we'll figure that out. We'll send that out to you. And again, Billy Vickers, thank you again. And we'll talk to you soon, okay?
Yep, sounds great. Thank you, guys. Thanks everybody for joining today.
Everybody have a great day. Bye-bye.